A 42-year-old man comes to the clinic for routine follow-up. He was diagnosed with type 2 diabetes mellitus and hypertension 4 years ago. He has often missed appointments with his physician. His current medications are metformin and lisinopril. He smokes 1 pack of cigarettes daily and drinks alcohol socially. His BMI is 33 kilograms per meter squared. Blood pressure today is 150 over 90 millimeters mercury. Laboratory studies show fasting glucose to 10 milligrams per deciliter. Hemoglobin A1C 9.5%. Creatinine 0.9 milligrams per deciliter. Physical examination is unremarkable. Which of the following is the most appropriate additional history to obtain at this time? Choice A, alcohol use. Choice B, diet. Choice C, exercise. Choice D, medication adherence. Choice E, occupation. Choice F, smoking cessation. 5 seconds and I'll answer your question. So I consider whether or not to even make a video on this because the original NBME question was also pretty easy, but hey, STEP has easy questions sometimes, and maybe some of you get confused by this. I don't think it's too hard to spot that the question is really laying it on thick for you that adherence is a bit of a problem for this patient. Choice D is the correct answer. Even putting aside the lab values, which pretty much hammer for you, his blood pressure and glucose levels, as well as his HbA1c, are all still very high despite the fact we give him treatment. And the line about him missing appointments with the physician, they would give a similar line to establish that he has a pattern of having trouble with his adherence for his medical care. I think they make questions like this basically to trick the students who too dogmatically follow what a lot of resources say. They get lost in the weeds of the epidemiology and they'll be like, oh, his diabetes or his smoking history contributes to his hypertension. And you kind of miss the forest for the trees, which is the question telling you over and over that he has a problem with something more fundamental. It's precisely because that it's so important that you have an intuitive understanding that you pick smoking or diabetes for so many risk factor questions that when they want you to pick something like medication adherence, they'll make it really, really obvious. So anyway, let's just run through the other answer choices real quick. Choice A, alcohol use. I mean, he doesn't drink that much. And if it really was that big of a problem, obviously they'd give you like elevated GGT or liver enzymes or something. Choice B and C, diet and exercise. Yes, this patient is obese, and it would definitely help with both his diabetes and his hypertension if you control his diet and exercise, but it's not the most pressing matter here. Choice E, occupation. There's a number of MBME questions that do need you to know a lot of these. A lot of them are pulmonary conditions, so basically the pneumoconioses. So a couple ones like coal workers pneumoconiosis. That one's pretty self-explanatory. They might show you a slide of dust cells from the lung, which are basically macrophages, which have phagocytosized a bunch of carbon particles and that sort of thing. Asbestosis, shipbuilding, roofing, plumbing. You'll see the asbestos/ferruginous bodies. On a stain, it will look like just this really long string. And once again, if they ask you what kind of cell it is, it's a macrophage. Silicosis, obviously something to do with sand, mining. Sometimes they'll tell you there's eggshell calcification on the hyaloid lymph nodes for a CXR. Supposedly you can see silica particles on biopsy, and they're weakly birefringent. So it'll be this really dark slide and it'll look like there'll be like some sparkles in it, which is the sand. I don't think I've seen that image on an MBME before though. Borreliosis, aerospace industry. You'll have non-caseating granuloma, so it'll look a little bit like sarcoidosis on a biopsy. But obviously the symptoms for borreliosis and the history will be totally different. Anyway, let's finish this up. Choice F, smoking cessation. Obviously people will tell you smoking is your fallback answer. If you have no idea what's going on in a question and you have to pick something, you pick smoking. Generally speaking, if they ask a question about like, oh, how do you improve general health/morbidity for the patient, it's going to be smoking as the answer. Almost every question that asks about MI risk, the answer is going to be smoking. Obviously lung cancer, renal cell carcinoma, transitional cell carcinoma, smoking, super high risk. We can sit here all day and list all the things that smoking could increase your risk for, but obviously the point here is that if you get a question like this one where it's just line after line they're harping on the fact that he can't control his existing illnesses and that he has something that suggests bad adherence, then yes, you pick that over the smoking cessation. I hope this video was helpful for you. I'll see you in the next one.